Hey y'all, Dr. J here, your friendly neighborhood marijuana doctor. So it's Super Bowl Sunday. I'm here in Kansas City at my second office, aka the gym, doing some stairs, and I got a question from somebody, and it's a question that I get all the time doing marijuana education and recommendations, and it is, what are the most common side effects of marijuana? The most common side effects of marijuana are dry mucous membranes, which is basically dry mouth and or dry eye, anxiety and or paranoia, the munchies, and short-term memory loss. Munchies. All right, so if you are not someone who is trying to stimulate their appetite with marijuana, then there are a couple things you can do to mitigate getting the munchies. First of all, tempering your THC dose. I found that patients tell me that when they take 5 milligrams or more, there's a much higher chance of them getting the munchies than when they stick to 5 milligrams or less, at least for eating it. When you are smoking or vaping, it is much more difficult to figure out how many milligrams you just inhaled. Even if you look at the back of the vape carts that say, oh, if you inhale so many seconds, it's this many milligrams. I beg to differ with that science. But either way, when it comes to inhaled products, you can help mitigate the munchies by choosing those products by terpenes. So there are certain terpenes that will increase your appetite. They tend to be the indica, stereotypical indica type terpenes. And there's at least one other terpene that's common in strains that will reduce your appetite. So picking strains that will not necessarily cause you to be sedated or have those terpenes in them can go a long way to avoiding that effect that you don't want. The other one is you can reduce the overall psychoactivity, including the munchies, fatigue, cognitive impairment of the THC that you're using by using CBD at the same time. So the ratio tends to be between 10 to 1 or 20 to 1 with more CBD, and you can get, a CBD only tincture and take that at the same time that you're eating something or before you're, vaping, and that goes a long way to mitigate some of those effects, including like sedation, munchies, cognitive impairment. These side effects videos are getting kind of long, so I'm going to put the other side effects videos, which are dry eye, anxiety, and short-term memory loss, in a separate video or two. Keep the questions coming though.